Are you okay? What's your arm? Which arm? This arm. Okay, no problem. I'm gonna continue on. Where does it hurt?
Right here.
Right here.
No, right here.
It hurts right there. Okay, hey, this is what I want you to do. I want you to hold your arm just like this, with this arm in a comfortable position, okay? Now what did we just do?
Mobilize them.
Right. We just put this patient in a delayed category. Now we can go back to the more severe injuries. So in this case, it would probably be the extremity wound or the abdominal wound. They're both in the same category at this point. Actually, yeah, it would be the gunshot wound, because then the patient's going to go into shock. So you would go and treat, and then come back. And so there are different ways. You're going to have 3 patients, so you have to continue to monitor mental status once you put them in the delayed category. So you can say, you know, when I say 1, I want you to say 2. When he says 2, you say 3. When he says 4, you say 3. Or when he says 3, you say 4. Okay, ready? Let's try it out. 1, 3, 4. All right, it works. And then you just every time you finish a treatment, just say, all right, guys, ready? 1, 2, 3, 4. Now you're assessing every 5 to 10 minutes. Okay. So we finished our other 2 guys who came up. All right, buddy. I'm sorry it took me so long to get to you. Well, here I'm gonna help you though. Sorry.
All right. So check the radial pulse.
I'm checking the radial pulse and establishing that yes, there is a pulse. Wow, it's a big bounding pulse too.
Position the fractured arm by having the cavity supported with the uninjured arm and hand in the least painful position if possible.
We've already done that.
Do not try to reduce or set the fracture, splint it where it lies. Immobilize the injury, apply an appropriate treatment depending on the location of the injury and the equipment available. Pad the splint. Well,
Go past that to the SAM splint. Are there 2 separate? Some of these tasks you'll see have 2 or 3 different methods, like the open chest wound. It has 3 different methods to handle that depending on what equipment is available. This one doesn't.
It's on page 2 or 3.
Okay.
It's second page on the bottom. Use a stem for tracking wrist report.
There we go.
Did you see it?
Right there. Okay. So prepare the splint using the uninjured arm for measurements.
So what we're going to do is you're going to take your SAM splint, fold it in half, and then size it up against the uninjured arm. So see right here, it goes right to the edge of his elbow and about 2 inches past his knuckle. What I'm going to do now, so there's a step in here where you have to apply something to his wrist, or to his hand, to keep the wrist up and elevated slightly. You can do one of 2 things. You can either, if you have the room here, take your SAM splint and roll it, or you can take an extra Curlex and stick it in his hand. So I've already measured this. Let's say that, just so you can see what I'm doing here. I'm going to take this. I'm going to measure my SAM splint. I'm going to come up his elbow just a little bit, and I'm going to size, or not size, but I'm going to mold my splint. There we go. All right, buddy. What I want you to do is lift this hand up just a little bit. I'm going to slide this underneath your hand and under this. There we go, just like that. And I'm going to take this. I want you to grab this in your hand. Perfect. All right. Now at this time, I have your arm. All right. Next.
So place the form splint under the fractured arm. Secure the splint to the fractured arm using provides for
Okay.
wrap.
Pause. Time out. So just so you can understand the difference, you saw what I did there. The other way you could do it is to either roll this like that, or depending on how, sometimes they won't let you do this because they say it's not a true blah, 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 but you can actually mold your splint and make kind of like a spica cast with it. See how it has that nice cup to it now? Yeah, it's not the best way. The better way would be to roll the edge of the splint like that. But I'll be honest, this is probably the best way. That's if you have your extra gear. And what it comes down to is, how much did you pack?
6 to 7 per bat.
All right, sorry, Les. You said immobilize, So I'm going to take, sorry, 1, 2, 3, 4. I'm going to take my 4 cravats because that's all they had, and I'm going to apply one below, one above, or other way around. One above, one below, the one above that, and one below that. So making sure not to be on the fracture site, I'm going to wrap and tie a non-slip knot not on the fracture. Can you just hold it on like this? Right over left. Don't like cinch it down either. Remember, he has a fracture. It needs to be somewhat loose, but left over right.
That makes sense.
Above and below again.
So is that, would we tell the patient to do that, to hold their arm up?
No, I'm just doing this so you can see the knots.
All right.
So you do that at the position where you.
Yes, in front of their chest.
You said left over right?
Left over right, right over left,
Matter?
right over left, left
Okay.
over right. It doesn't matter.
Alright.
I don't know. I know what's a slip.
So 2 closest to the wrist and 2 on top of the forearm?
Right.
Would that be fine? Just like-
Now, keep in mind that you don't want to cut off circulation, and you still need to check the pulse.
Yeah, it says
All right.
in here, check the pulse after each combat is applied.
So every time you do that, you have to check the pulse. All right, now my next one, check the pulse. Now the next one, check the pulse. Now the next one, check the pulse. Pulse is still present. All right, and there are four cravats on here. I'm going to, can you help me with the other? Take this off. All of them. Go ahead and pull it.
Touch your injured man.
Now, the easiest way to do it is, now that the patient's arm has been splinted, you take your ACE wrap and you apply your ACE wrap. I have control of your arm, all right? Not causing further injury. Apply the ACE wrap. Make sure to support it down. Okay, good, you're supporting, good. I'm immobilizing the arm.
Could you ask the
Ensuring-
patient if it's too tight?
Yeah.
Could you ask
Yes.
them, hey,
Oh,
is
yeah.
that too tight? Is that
Let me
okay?
know. Let me know if this is
Yeah.
too tight or if it's going to cut. If it feels like you're getting pins and needles. Okay. Also known as ischemia. And see, it has Velcro on it. Don't count on the Velcro because chances are you're going to get out there and this thing is already going to be used like 7, 8, 10 times, and the Velcro is going to be all gunked up, just like these. So put tape on it. And I have a nice little window where I can roll this baby back. Baby back, baby back, baby back. I can roll this baby back and check and assess my pulse. You can even, so I started at the hand and worked my way back. You can even go the other way. Oops. Start at the elbow and work your way forward. And it doesn't matter if you cover the break with the ACE wrap because it's a soft, pliable material. I'm going to cover the hand but not the fingers. Why don't you want to cover the fingers?
So you
Check
can assess
for-
for capillary refill.
Capillary refill, right? Now what do I have there? I can check capillary refill, and I still have my window to assess the pulse. The patient has a pulse. Here you go, buddy. Hold that. All right, what's next?
Apply an arm sling and swap using cravats.
All right, I have my. I won't use that one on you. Now it has chunks of bone. All right. So I'm going to very carefully slide my sling under his arm. Actually, before I do that, you have to tie a non-slip knot in the, call it a pigtail, in the edge of the cravat. That's that way it cups his elbow. Do it first so you don't forget it later. The problem with doing it after you've already applied the sling is now you have an arm there that's going to impede you and you're pulling it further and further back so you can get that. So the best thing to do is to tie it first. And you saw all I did was a simple overhand knot. Twisted and tied. All right, buddy. sorry. Making sure to tie your knot on the non-injured side of your arm. All right, Sergeant, what instructions do we have here?
So insert the splinted arm in the center of the sling, bring the ends of the sling up and tie them at the side or hollow of the neck on the uninjured side. Twist and tuck the corner of the sling at the elbow.
All right, how does that feel? Put weight on it. Good? Okay. Non-slip knot on the uninjured side. All right, next.
Says a sling should place the supporting pressure on the casualty's uninjured side. The supported arm should have the hand position slightly higher than the elbow. Apply the swap. Apply swaths to the injured arm by wrapping the swath over the injured arm, around the casualty's back, and under the arm or on the uninjured side.
Good. This one will fit. So you see,
It fits, but you
He's
don't.
skinny.
yeah, you see the type of person that this fits on, and this barely fits.
So
Okay.
he's two.
Exactly. The best thing to do is if you have questions, just tie it twice before you even start. Because I can tell you right now that this is using the very tips of the cravat.
He's skinny.
There we go, non-slip knot. How are you doing? I still have a pulse. Notice that it didn't go over his hand. It went over the arm, over the sling, and to immobilize the arm. Now, what you don't want is like the chicken wing going on. So if it is flopping around, you may need to tie a little bit tighter. Okay, how are you doing? How does that feel? Good? All right. I'm looking for capillary refill. I'm assessing for pulse. There is a pulse. Did not cause further injury to the patient. What next? Yes.
Could we just double that if we have a big patient, like 2 cravats?
Yeah. You can use as many cravats as you want. Usually the one thing that I have